Let's say you are a 26-year-old guy living in California, making close to $400,000 a year. You're a decent guy, new to the dating game, but your worst flaw is that you are 5'7". You have been rejected by girls all throughout your life just because of your height. Even your family tells you that you are short. Even your friends tell you that you are short. But after earning a lot of money, fast forward 3 years later, you make a life-changing decision about getting bilateral femur lengthening surgery. And after years of feeling insecure, you go from 5'7" to 5'11", 4 extra inches. That brings up your confidence. Even though the recovery process was hard, challenging, stepping into this new life, you feel confident about yourself. This confidence that you feel right now is untouched. However, you start dating a girl. Now a new challenge emerges. And the challenge is to keep your surgery private or tell the truth to your new girlfriend. And one of the situations arises where you was able to disclose this important piece of information about your life, but you ended up holding back and you ignored the truth about your height transformation from your new girlfriend. I just want to ask the audience, what would you do in this situation? Would you tell your new girlfriend that you got limb lengthening surgery? Or would you ignore the fact and let it go, put it in the past, and move on? What would you do? Welcome back to the channel. My name is Harsh Patel. I'm a physician assistant student, and today we will be talking about the topic of limb lengthening surgery for short men. This is a very interesting topic, so just let's get into it. So first things first, the cost. The top 3 countries that offer limb lengthening surgery are United States, Turkey, and India. US will be the most expensive in offering this surgery. The cost is anywhere from $50,000 to $100,000 or even more, depending on the location and the amount of resources that is required, honestly. And then the second will be India in terms of the cost, and they are going to offer for about $5,000 or more, depending on a lot of factors. And then it will be Turkey. It will be about $15,000 to about $30,000. Next thing I want to talk about is that everything like about height. So what we know from science, history, to the meaning of height in our society. So the first things first is the science, okay? So we know now from various research studies that about 80% of height is genetic in Caucasians versus only 65% genetic for Asians and Africans. Now, this type of inheritance you may have learned in your general biology class would be this polygenic inheritance, in which many genes affect a single phenotype. So a lot of different genes kind of affect your ability to get to a certain height, and both of your parents contribute to that. The inheritance of these variants from one's parents helps explain why children usually grow to be approximately as tall as their parents, but different combination of variants can cause siblings to be of different heights. So it's not that you will have a fixed height determined by your parents, but there will be variations in that gene, okay? And high quality nutrition also plays a role. So when we talk about nutrition, if a child gets proper nutrition, proper proteins and vitamins, that helps them maximize their genetic potential. So let's say if a dad is 5'9" and mom is 5'3", if the genetic potential of that kid is about 5'10", unfortunately, if the kid was malnourished, which is not the case in developed countries, but hypothetically, they might not grow to 5'10". They might grow to 5'5" or 5'3". We don't know. Studying polygenic inheritance is probably one of the toughest research you can conduct. So high quality nutrition maximizes genetic height potential, but this extra nutrition that the developed countries get, like higher quality protein, more protein, vitamins, minerals, can really give you some more inches. And so what are some key nutrients for height growth? And so the top 3 are protein, vitamin A, and vitamin D. And I want to really emphasize this concept into the immigration of Indian people, right? So the average height in India for men is 5'5". But what has happened is the people who came to the United States early and they raised, and those parents raised their kids here, the protein quality went up. The amount of protein they were eating went up. They were eating more vitamins and more minerals. I don't know if there's a research done about this, but if we only look at the immigrants who were born in India versus the children of immigrants who were born in the United States and do a height comparison, I'm pretty sure the children of the immigrants would be taller than their parents. And so this also kind of ties into the concept of height in specific countries. So you will see that India, that is prominently vegetarian country, will have a lower average of height compared to like European countries. And you will see that. So what is the average height of people, right? So average height worldwide is 5'7" for men and 5'3" for women. And this was recorded in 1996. This is the most highest quality data recording about height. Any of you in the comments could link any research that is more recent. Feel free to do so. Historically speaking, on average, modern humans are 5% taller than the humans 100 years ago. So that's the contributions of higher quality food, more protein, industrialization. Most growth has come in European men and least growth has came in South Asian men. Similar trends in women. So that's so fascinating. South Asian men are shorter on average. Historically, they have been shorter, and the most growth is seen or was seen in European men. And I'm assuming that's due to eating more protein and having better food. And so this kind of shows like two cultures and how height can differ between the two cultures, largely contributed by the environment. Okay, our genetics may have not changed, or probably have not changed at all in the last 100 years. But what has changed is our environment and is our quality of food. And these culture-specific differences highlight those facts really well. What is the meaning of height in our society? So I think we can look at this in a lot of different angles. So we can look at this from social status. We can look at this from dating preferences. And then we can also look at this from personal experiences. There are a lot of personal experiences on Reddit and on social media that we could rely on too. Like evolutionary psychology research and just research about social status does say that height predicts dominance and social status. So when I was younger, height did play on my mind. I'm 5'5", so I felt a little bit less dominant because I am short. But that played during my teen years because everyone was growing and I wasn't growing. And that played on my self-esteem as well. So having a shorter height does play on your mind. So your perception of self and your self-esteem is lower. And this is backed by evolutionary psychology research. It's not that you cannot change your self-esteem through other ways, through other things in your life, by bettering other aspects of your life. It's just saying that height is kind of, you not only perceive yourself to have low self-esteem, but even others perceive you as less dominant if your height is short. this is true in our society. There is no denying it, and we have grown with it. Everyone knows that if you're short, your chances into getting into, let's say, a height dominant sport are lower. You don't see a lot of short basketball players. You don't see a lot of short football players, because being short also means that you can pack less muscle mass. It's not that you can perform less. There are sports where you can perform more or better if you are short. Like, let's say powerlifting is a great way to show how you have different weight classes, and you can really better yourself in your weight class. You don't have to compete with like an 83 kilogram person if you are 74 kilogram. One of the biggest concerns right now with dating is what people like and what people prefer in a person who they want to date. With women, yes, they prefer height. Yes, they prefer taller men over shorter men, but that's only one variable. And yes, increased height is a masculine feature and suggests higher genetic quality. It is backed by research, evolutionary psychology, etc. And then my own personal experience about the meaning of height is, growing up, I was always called short. Yes. I was always made guilty about the fact that I'm short. And even though I didn't like it, I just took it, from family. With dating experience, I would say no one said no based on my height, but I don't know. No one really tells you the truth these days. Like, in terms of dating, like, no one really tells you the truth if you get rejected by a girl or something. In my experience, height hasn't played a role that much, but I feel like it definitely played a role in terms of like attracting girls. And then other thing is, like, in my observation of the world, I do feel like if you are taller, you get more attention. Like, it's not about getting attention from the sex you are interested in. It's just about the attention from the world. I think that's in my understanding and my observation of the meaning of height in our society. Because if you are taller, you just stand out physically. And there might be other biological factors of the benefits of being taller. Like, you're heard more, you're perceived more as dominant, obviously. You're perceived more as having like social status and wealth. And so height represents a lot of different things. It's kind of going back to like Darwin's theory and stuff. Let's talk about how the surgery works. And so the procedure is, well, basically you will go through the pre-op stuff, right? You're going to go get x-rays and CT scans and whatever that's needed. There's going to be a thorough medical evaluation to ensure that you are a candidate. You are a good candidate. But then the actual procedure is kind of like frightening, to be honest. They cut the bone they are going to work on. So if they're going to work on the femur, they're going to cut the femur, and that's called osteotomy. And then fixation devices are placed. And so you may get like an external fixator or like an internal fixator. These external fixators are like metal frames that are attached to the bone through pins or wires. Or you may get like an internal one that is like a telescopic rod inserted in your bone. And these devices are designed to gradually separate the bone ends, allowing the new bone to grow in the gap. And there are certain phases of the recovery process after the surgery. There is something called lengthening period, where it is 6 to 12 weeks, about 2 to 3 months long. And the patients use the device to lengthen the bone incrementally. So I feel like the patients have the control. It is about like a millimeter a day. And then you have to do regular follow-ups with the surgeon to ensure proper alignment and bone growth. Pain and discomfort are common, but these are like managed by pain medications. Like, you can be prescribed like opioids or just general pain meds. And then physical therapy will start to like just maintain joint mobility and muscle strength, because you want to keep the range of motion and you want to keep the muscle strength so that after the recovery process, you're not going to just be a broken body. Next phase is the consolidation phase, which is about 3 to 6 months, or could be more depending on the patient profile. So once the desired length is achieved, the bone is allowed to heal and harden, and the fixator device is remained in place during this phase to stabilize the bone. And after that, the internal devices are removed via a second surgery. So there's kind of a follow-up surgery. And then either if it's internal or external, I don't know specifics about that, but both will be removed. And then we'll have to do the rehab. So physical therapy, you will have to do regular physical therapy to regain the full function and the strength of the muscles and joints around, and then gradually increase weight-bearing exercises so the new bone that is formed could take that load that you're trying to give it. Post-surgery, there is pain management, muscle relaxers, blood thinners to avoid clotting from excessive immobilization, because one of the complications you can get, not even duration of the surgery, but also post-surgery, because this makes you bedbound, is the formation of deep vein thrombosis. And so deep vein thrombosis is like a clot from your leg that is traveling up in your veins. It could go in your lungs, your arteries of the lungs. It could go in your arteries of the heart. It could go in a lot of places. So these medications are prescribed to prevent the complications. And then antibiotics may be used to prevent the bone infection, osteomyelitis. Some supplements that are recommended, and they're probably highly recommended, because you don't want to interfere with the healing process of the bone, because you're essentially what you're doing is you're creating a fracture, a controlled fracture. And so the top supplements would be calcium, vitamin D, vitamin C, magnesium, vitamin K2, and most importantly, having a higher protein diet. Not the minimum that's required, but the highest you can tolerate. Physical therapy is extremely important. Range of motion exercises in the early phases to prevent stiffness. And then they also kind of have you do isometric muscle contractions to maintain muscle tone. Regular stretching of the muscles around the body. And joint mobilization, actively or passively, this will be helped by the physical therapy team. And then in the later phases, there's a combination of strength and balance exercises, restoring walking pattern, endurance training like running and swimming. Next, two things are sad, but that could happen. So some of the factors that can hinder recovery would be non-adherence to the medications, non-adherence to nutrition and physical therapy. Infection of the bone and of the surgical site can also hinder recovery, slow recovery down. Poor lifestyle like smoking, taking drugs, alcohol, and poor sleep can really impair recovery, because this is a very sensitive healing process. Any chemicals that you put in your body can have impacts on this recovery. And then again, if you're experiencing chronic pain with this surgery, that could also hinder recovery, because you're going to be more irritable and you're less likely to do physical therapy. Factors that lead to lifelong disability would be joint contractures, which are chronic or lifelong permanent joint stiffness and loss of function. That you don't want that. So that is why proper step-by-step recovery process is administered for these patients. Delayed bone growth and misalignment of bones could happen, which can kind of alter the anatomy of your legs, and in turn can impair your walking. So if you compare your walking pattern to before surgery and after surgery, it would be really different, and that could be one of the complications. Loss of strength could happen because you're not using your muscles that well, and then just how the bone grows can impact the nearby structures like muscle. What could also happen with this process is also nerve damage. So there are a lot of nerves that go in the anterior compartment of the leg and the posterior compartment of the leg. And so any kind of bone growth that impinges or any any growth can impact the nerves around it because everything is just close together and packed together. Other things like infection again. And then lastly, compartment syndrome can also happen because sometimes, like with the leg surgeries, like the pressure could build up in muscles, and that could lead to severe muscle tightening, and eventually this requires, unfortunately, amputation. So why may you get this surgery? So some of the reasons that I came up with and Redditors came up with is like having height insecurity. That's probably number one reason. The second reason, you might want to improve your dating game. More height, more dates, right? Then you just want to max out your looks, right? So if you're, let's say, 5'8", you look decent. But then if you want to just max out that 10%, just maybe 5% more of that, the height. Maybe height is something that's impacting your ability to be like the third most sexiest man alive. Then yeah, you may get a height lengthening surgery. People don't take you seriously, maybe that's why you want to do it. And then lastly, you just want to look dominant. Like some of the pros of this surgery from the external, like from the world that someone else sees you from, could be it makes you more attractive because taller individuals look more attractive. Like we all know that those YouTube videos, the real life Tinder swipe right, swipe left ones, I'm pretty sure like sometimes like being taller does play a role. Another pro is just being taller, like actually being taller 2 to 4 inches is a game changer. And lastly, clothes fit better. Like if I imagine myself being like 5'9", I know my clothes will fit better and I won't have to use a tailor that much. So what are the cons now? So cons are, it is expensive as hell. I don't think I'll ever use $100,000 on a surgery with all these complications. But that's more on to my personal opinion about this. This surgery fixes problem now, and it prevents you from believing that if it is uncontrollable, then just let it go, or that conscience goes away. It also makes you believe that height is more than personality. And that is one of the things you might end up having, that after you fix that height, you still are having the same troubles. And then you figure out after, let's say, 5 years down the road after the surgery, that your personality was a problem. You also put on a lie for people. Like the story that I shared at the start of the video, like you're basically putting on a lie for people, anyone, your future wife, your family. You're just not living a life that's true if you plan on hiding that fact. Other cons are just long recovery and long-term use of medication and supplements. Like the recovery is so long that you may just question your decisions. It takes you about 1.5 years to just start walking again. So in that whole process, you may just start wondering, like, what's the point of this? And long-term medications, again, I'm not a fan of taking long-term medications unless I have like a chronic disorder, but this is just cosmetic reason, right? However, I would like to connect this surgery to a very interesting topic. What if an individual who has been struggling about height, about the truth about their height, that they're short, what if it's just body dysmorphic disorder? Body dysmorphic disorder is included in the spectrum of obsessive compulsive spectrum. And I'm just going to go over the DSM-5 criteria. Body dysmorphic disorder is a preoccupation with more than one perceived defect or flaw in their own physical appearance that is not observable or appears slight to others. At some point during the course of this disorder, the individual has performed repetitive behaviors or mental acts in the response to the appearance or concerns. For example, if you're short, you may keep measuring your height. And this could start when you are like a young adult, like 16, 17. You keep measuring your height every single day, maybe every few hours, to see if you gain any height. And I know it sounds so absurd, but I'm pretty sure there might be some people in this world who are going to do that. The next criteria is the preoccupation causes clinically significant distress or impairment in social, occupational, or other important areas of functioning. So this creates low quality of life. Lastly, the appearance preoccupation is not better explained by concerns with body fat or weight in any individual whose symptoms meet diagnostic criteria for an eating disorder. So it's not explained by any other disorder or like body fat or weight gain. The treatment is treating the underlying cause. Two of the most associated conditions with body dysmorphic disorder are major depressive disorder and OCD. So if this thought of height is bugging you for years and you are checking the criteria, first of all, you have to consult a psychiatrist. Then you got to ask yourself these questions, okay? Is this cosmetic treatment going to be worth it? I'm just going to tell you that what we learn in our behavioral medicine class is that body dysmorphic disorder responds really poorly to cosmetic treatment. So this dysmorphia that you have about height may not be cured by cosmetic treatment. There is something deeper, something mental going on, something psychiatric that needs psychiatric evaluation, and it will not be fixed by just lengthening your limbs. So the most effective treatment for this dysmorphia would be underlying the actual cause. So if you have depression, you have to go on an SSRI, like antidepressant. If you have OCD, you have to consult a psychologist or a psychiatrist to fix that issue. You additionally have to consider psychotherapy, and because psychotherapy can be life-changing for a person who is struggling a long time with these issues of height. So what do I think, right? My last thoughts are, what if this is one of those things where nothing changes after you achieve something? We have heard of countless stories of people that earn more money and that doesn't fix anything. They have the same mental issues when they were earning $50,000 a year compared to when they were earning $100,000 a year. Getting in a relationship doesn't change a person's well-being. I have known people who have not changed their single mindset about how they felt from when they were single compared to were in the relationship. You have to be happy when you were single or are single compared to being in a relationship. Like, it does not have, you don't have to believe that a relationship will fix your well-being. Lastly, working on your dream career doesn't improve your motivation. So if you always wanted to be a doctor and you ended up becoming a doctor because your kind of family forced it and now you don't like that career, you're still at the same place where you were at. What if this surgery is just like that? I would say to focus on your mate value. Mate value is kind of aspects of you that makes you a good mate. And so the best book that helped me out was How to Unfuck Your Life by Dr. Justin Duranzo. And he was on the podcast too. And so I'll just link that book because that helped me a lot with my relationship issues. And honestly, that's the best book that I have found to kind of fix my own relationship issues, which I haven't really shared, which I will one day. But I have had a lot of relationship issues with my current girlfriend for a long time now. And I think that book really helped me out a lot in terms of like kind of understanding who I am and who I want to be with, and kind of what questions to ask your partner, and what is my correct mate value. Mate value, again, is the characteristics of you as a person that makes you mateable, like characteristics of you that makes other people, not other people, but your partner want to have sex with you for a family, for babies. And that's kind of the most simple and straightforward and direct way I could explain. Focus on that book, and I think that will help a lot of short men out who are struggling with kind of dating aspect of this. honestly, for me also, there are more cons than pros because, like, as you can see, the risk outweighs the benefit. The risk benefit ratio of getting this surgery is just too high. Unless you have like medical conditions like congenital leg length discrepancies or any post-traumatic injuries or growth plate injuries, like this, if this is a purely cosmetic treatment, I think it's a very bad idea. And I might be just sitting here in my house just telling you if it's a bad idea. You have to figure that truth out for yourself. But is it worth all this money and all the recovery time? It's just a question for you. You might want to look up more Reddit stories. You might want to look up more YouTube videos and make a decision for yourself. Never let anyone else make a decision for you. And I hope this video brings out perspective and kind of ignites your own decision-making skills. Because at the end of the day, and point of our whole life is to just make the correct decisions for ourselves and not anyone else. So I hope you like this podcast. I'll catch you in another one. Please take care of your health and keep achieving your goals. See ya.